Now, COVID-19 has exposed the weakness of South Africa's public health system. Already a dire shortage of oxygen has been reported in the Eastern Cape, and dirty hospitals have featured in international news reports. So does that mean South Africa desperately and urgently needs a national health insurance? Or does it mean South Africa should first fix the current weaknesses? To discuss, we're joined by public health medicine specialist Dr. Nicholas Crisp, who's also a consultant to the Department of Health. Doctor, thank you for being with us. You've basically suggested that it all would have been better if we were already basically under a national health insurance system. Tell us why.
Thanks very much, and nice to be with you on the program. Well, basically, a large part of our problems is the fragmentation of the way we deliver services and the many administrations who are involved, both in the public and the private sector. It makes it extremely difficult to coordinate, first of all, data collection to know where the challenges are, but also to understand where the deficits are in the health system and whether one is able to shift resources around to support those deficits. So if we had one health system with one common way of approaching everything, it's definitely easier to manage when there are times of emergency such as these.
So a few issues about an NHI have been raised. What about corruption? Tonight we're talking about COVID premiers. The NHI will be a centralized system, seemingly from the way it's been conceptualized, covering healthcare, and the incidence of abuse can then be even bigger.
Well, not necessarily. I mean, the NHI is a financing system that is designed on a purchaser-provider split, where the purchaser is a centralized purchaser of services from both public and private providers. So it's a simplification of the entire NHI debate to suggest that it's going to be just a centralization of everything. Yes, there will be centralization of procurement, and not for all services, but certainly for personal health services. But it's not necessarily so that just because you're centralizing the funds, you get more corruption. You have to design into the systems, and that's the objective of the NHI, the way in which the systems are designed to prevent corruption, both on the procurement side, the patient's side, the provisioning side, and so forth. And we don't have those kinds of protection mechanisms in the current procurement systems. So we can in which we design the system going forward.
All right, so you say it can be corruption-proof in a way. What would you say to those who say we already have a public health service? The NHI should just be an extension of that, better resourced, more efficient. But we act like it's something fundamentally different. And we're talking about the future and not focusing on the public health system right now. That should work anyway.
No, I mean, it's not true that we're not focusing on the public health system. We need a strong public health system. There's no question about we need a public health system that works. And we have programs and various initiatives in place to improve the quality of the public health system. Right now, we're in a particular challenge, and this challenge with COVID is exposing all kinds of challenges that we knew before, and we're already embarking on improvements of. But it doesn't mean that you only need to improve the public health system. We are well aware of challenges in the private health sector and problems with distribution of resources between urban and rural areas, distribution between the public and the private sector, staffing across the sectors, and so forth. And it's these inequities which make it extremely difficult to provide healthcare to everyone.
Let me ask it in a different way. I mean, if we can't stop Eastern Cape hospitals from collapsing and being featured in global news after a nationwide lockdown that has spelled disaster for the economy, that was all about getting a healthcare right for COVID-19, then why would everything be much better if we move to this NHI?
Well, look, I don't think we're going to deny that what we've seen in the Eastern Cape is not satisfactory, and in some cases is outright dangerous and devastating, and we're all appalled with some of the pictures that we have seen. But it doesn't mean the whole country looks like that for a start, and it doesn't mean that every hospital in the Eastern Cape looks like that either. There are there's every reason why, if we were coordinating and managing the programs together and running the entire health service as a national health system, where everybody was interested in the same standards, monitoring those standards, sharing the resources, and working together to develop a proper public health system and a proper health system for everybody in the public, that we can overcome the problems that are being seen in the Eastern Cape. There are also parts of the public sector that have done extremely well and have shown us that they have extremely good services with good outcomes. So I think that it's unfortunate that we focus only on those that are really bad. It would be nice to see that there is quite a lot of the public service where people are working very hard and doing extremely good work, not only now in COVID, but always.
I agree. And finally, let's end with this. You're saying that COVID-19 has shown that the public and private sectors can work together. Just explain that and how we can expand on that, because many are concerned that the efficiency of the private sector will be undermined. Caps on what doctors can charge. They won't attract excellence anymore. But you're saying inequality has to be dealt with.
Yeah, it's not, you don't continue to pour a whole lot of resources into a health system and always expect to get the same kind of results back. What we would like to see happen, and what we have seen happening now during COVID, is that all the parties are getting around the table and saying, what can we do to help? And the private sector was very open, and they said, just at cost recovery rates, we can make resources available. We can work together with the public sector to see patients that, whether they're public sector patients or private sector patients, so that we all work together to overcome this particular problem we have. And that working together has resulted in us showing up with global tariffs, with all the different complex role players in the private sector contributing towards some kind of service level agreement which is structured for the benefit of everyone. And that, I think, augurs extremely well for us working together going forward.
All right, thank you for your time tonight. That was public health medicine specialist Dr. Nicholas Crisp.